Well, hi everyone. Welcome to our SHARE webinar series. This is our third webinar that we're having today. We've got a few people still just entering, so might just we'll get started with some of the background things as more people just start to enter. So, but firstly, just to acknowledge that in the spirit of reconciliation, Bolton Clarke acknowledges all Aboriginal and Torres Strait Islander traditional owners of country throughout Australia and recognises their connection to land, sea, culture and community. And we pay our respect to elders past and present and extend that respect to all Aboriginal and Torres Strait Islander peoples. All right, so just a little bit of housekeeping. Please, all attendees, can you please just turn your video and microphone off during the presentation. Afterwards, when we do the questions, then happy for you to turn your cameras on, or but please just put questions in the chat and we can come back to those at the end in the Q&A at the end of the webinar. All of the recordings and presentations will be made available on the Bolton Clarke website, so we'll be able to let you know when those are uploaded and available for you to review. All right. So my name is Xanthe Golenko and I'm a research fellow with the Bolton Clarke Research Institute. And I'm also leading our SHARE program. So SHARE stands for Storytelling in Health and Aged Care, Research and Education. And it's really a body of work that's been evolving over the past 3 years that encompasses a whole range of different projects. So today we're going to be talking about transforming the future health and aged care workforce attitudes towards ageing and aged care through storytelling. So I guess just a little bit of background. As our population ages, there's growing urgency really for health professionals to understand the care needs and preferences of older adults with complex health conditions. However, current training for future health workforce offers few opportunities to gain experience working in aged care settings. So to address this gap, Bolton Clarke is partnering with universities to offer students from a range of health disciplines, including social work, occupational therapy, human services, community welfare, nursing and paramedicine, to engage in a storytelling program in residential aged care homes across Australia. So storytelling really allows students to get to know the person behind the health condition, which helps to develop empathy and compassion. And students also build confidence in being in aged care settings and learn how to communicate effectively with older adults. And this transformative nature of storytelling can help to develop positive attitudes towards caring for older adults and working in aged care settings. So we've got an incredible lineup of speakers today. Just very briefly, we've got Dr Asmita Manchha, who's with Bolton Clarke. She's going to be talking about her PhD work around stigma associated with working in aged care. We've got Claire and Elizabeth from Curtin University in WA, going to talk about their research and work with occupational therapy students. We've got Trish, Rowan and Claire Hauser from QUT, again talking about their experience but with social work students. Sharon Andrews from the nursing perspective, and then we've got some wonderful students who have actually been involved in our program going to share their experience with you, and 2 of our lifestyle coordinators from our care homes who have hosted students. So we wanted to really explore multiple perspectives in this presentation. All right, so I will now hand over to Asmita to give her presentation. Thanks, Asmita.
Beautiful. Thanks, Xanthe, for that introduction. And I will now share my screen, which is something that it will go smoothly, I hope. So work I have conducted during my PhD which was at the University of Queensland, but it's also something we are interested in exploring in Bolton Clarke. So today, before I start, I'd like to emphasise that even though I will be talking about negative perceptions and stigma and some kind of myths and stereotypes we have around people who work in aged care, I'd just like to respectfully say that there are two sides of the story. We are challenging these negative stigmas to try to focus on the positives of people working in aged care and all the value that they contribute. So at any time, I try to be respectful, but I will use words that may emphasize stigmatizing language, but I will say this in a positive way when I can. So to start, we are providing a little bit of context that I'm sure you're aware of. In the aged care space, specifically focusing on workforce challenges highlighted in the Royal Commission, for instance, there are numerous concerns that people have explored. This can include attraction and recruitment of aged care staff, education, working on the ground floor in terms of time and work demands, care quality and safety, pay, turnover for our ageing population, as well as what I'm going to be speaking today in terms of reputation and status. My research focuses on primarily how these workforce challenges tie into these negative attitudes that we may have in society around aged care work, workers, and institutions. And in this PhD, I was focusing on stigma. Stigma comes from a social science perspective in psychology, which is referring to when we discredit people or people associated with attributes. And in the aged care workspace, the literature has spoken about aged care work being seen as dirty work. It can be associated with these negative stereotypes and ageism because we are caring for the population that may be perceived as less than. We can also see in the literature aged care work or people who work with older adults seen as not the most highest popular choice. And also, unfortunately, aged care work is seen as socially devalued compared to other professions, for example, in the acute care sense. Now, I'm presenting today one of my recent publications, which explores a review process of the academic literature that looked at stigma associated with working in aged care. And just to clarify what I mean by this is when people discredit and devalue the work, workers and institutions in the aged care context. So in this particular paper, we were interested in exploring what exactly is the stigma of working in aged care? How do people define it? What do people think about when they think of stigma? As well as what are these negative consequences of stigma in terms of staff outcomes, in terms of quality on the care. So here is a short kind of snippet of this article that you can refer to and search, or let me know if you would like a copy. I can send one to you. And special thank you to my team that supported throughout the research process as well. Just a quick snapshot of what a systematic review is. It's a large review process that you examine using quite a rigorous process, which is employing the PRISMA guidelines, and it involved reviewing peer-reviewed articles. So reviewed articles that went through a rigorous process to start with, and they were published from 1973 to 2019, which was when I conducted the study, and across these 5 databases. I was primarily interested, as I mentioned, in the stigma of working in aged care and focusing on workforce, as well as in a context of aged care. I acknowledge there are different types of stigma also related to aged care, which can be associated with dementia care, status in terms of people's minority ethnic groups, but that was something that wasn't the primary focus of the study. We only found 59 articles that describe stigma, and very few actually describe these negative consequences on workers from an empirical stance. So we took a language approach to summarize how people conceptualize and understand the stigma. And again, I used a framework from social psychology, which looked at stigma processes, but I also took a more narrative approach to understand how do people communicate stigma in the everyday context. We broke this down into 3 overarching ways of conceptualizing stigma related to working aged care. Firstly, focusing on unfavorable character judgments that were focused on workers in terms of maybe their skills and ethics. So for example, here's a quote. So I feel the less experienced and most out-of-date nurses seem to care for older people. So this is something that is stereotypical and unfortunately can be a myth in our society. We also looked at the lower status and value placed on the work itself, whether it's associated with the profession or the nature of work. So the profession can be seen as less than, and the nature can be seen as maybe to do with the pay or the demand. So we've paid less, but we work the hardest. And compared to other people, aged care workers are underpaid. And lastly, we focused on these negative emotional reactions that were associated with working aged care. And hopefully this is something that we can challenge today in hearing about student stories. And traditionally in the literature, there has been negative comments about working in aged care compared to other professions. And sometimes you can hear things about people saying they dislike or they're disinterested. So some people think that working aged care is depressing, it's sad. That's the stigma around it. Although we found in our study that different social groups focused on these stigmatizing language, for example, society as a whole focused on negative character judgments towards workers and work. The workforce specifically honed into the nature of the work, focusing on the low pay, and students focused more on these negative emotional reactions they experienced. Again, as I mentioned at the start, this is only one snapshot. We have different views about working in aged care. Personally, I really enjoy and I'm very passionate about seeing these positive values that we bring. But unfortunately, there were stereotypes and stigma that led to consequences on the workforce. And this could be in terms of psychological outcomes we found that affected the workforce in terms of burnout, self-worth, and esteem. And we also found to do with the work itself. Some workers reported feeling dissatisfied, more likely to leave their job, and recruitment was something that has been challenging. The key takeaway was that even though in the academic literature there may be a lack of attention to these issues, this framework that we produced is some way of bringing together this anecdotal evidence, so something we hear in the community, these comments, but is some way that we can measure and identify in an empirical way, so we can then challenge these thoughts. Another takeaway I would like to mention, taking a language approach, is that stigma is reproduced through communication. And through this dialogue of talking to each other, that's where our attitudes about aged care are established. So you might often hear from someone else, they say something negative about aged care, and you may either agree with that or challenge the stereotypes. So try to bring a positive lens. What can we do about this stigma? So we can do some positive things about changing these negative stereotypes and challenging these perceptions. We can reflect on our own experiences, perceptions, and stories. And that is something that we do in this program. And we do try to focus on their negatives and their positives and bring it together. We can understand the language that people use to reinforce stigma and find ways of reframing this language to focus on the more positives and the values behind aged care work. And one key takeaway for policy and practice is looking at how to reframe these negative valuations. So at a societal level, we can have this more positive outlook. And I just like to leave you with something to think about. And I'm sure because you are here today is something that you are interested in learning more about how we can support our future healthcare workers in the aged care space. So think about maybe how we can let the stigma be part of our everyday conversations. Let it be seen, heard, and challenged, because by bringing it through our discussions is one way we can address it and identify its problem. So thank you very much. Happy to answer any questions later. Here is my email address if you'd like to hear more. Feel free to reach out. And I'll stop sharing my screen.
Thank you so much, Asmita.
Thank
I
you.
love this. I just think it's such an important study, and it's a great kind of way of framing this this webinar today, and the importance of working with students and acknowledging, you know, the I guess perceptions of aged care, working in the aged care industry. So if you've got any questions for Asmita, please pop them in the chat, and we will revisit those in the Q&A session at the end. So I'd now like to hand it over to Claire and Elizabeth from Curtin University in Western Australia.
Lovely, thank you everybody. So this is a presentation from myself, Claire Morrisby, and Elizabeth Oliver, who's sitting in the room with me. And we'd love to share our experience over the last sort of 8 to 9 years, where we've worked with students in occupational therapy students who are doing a project in residential aged care facilities. I'd also like to say thank you to everybody and acknowledge the Whadjuk Noongar people, the land on whom we're sitting today over here in WA. It's a beautiful sunny day, and I hope it's a beautiful place where you are as well. So we are occupational therapists by background. I've been an educator now for 11 years, working at Curtin University, and I'm passionate about seeing occupational therapy students develop into amazing occupational therapists.
And I'm Elizabeth. I also teach at Curtin, and I run my own business, Memory Box Collective. So throughout this project, I was lucky enough to be one of the community partners. So I would have the OT students coming into the facilities that I was working as the senior OT in order to start off this project.
And that's where it began. It began as an opportunity for us to develop a partnership that aimed to support students to develop really important skills towards being an occupational therapist. At the time we started this project, we had about 40 OT students, and these are first year. At the time they were first year, first semester. It's now moved to second semester. So they were very new into this profession, very new into the idea of working as an occupational therapist. We've now grown the project over the past 8 years. We now have about 80 students in this unit. And so that brings with it challenges as well. And so we pair the students together to work with a single older adult living in residential care. And over a period of 12 weeks, they develop a relationship and collect the life story information of the person. At the same time they're doing that process, I asked them to do another more clinical-based assessment, looking for what the person's occupations of meaning are and how we could support those within the context of the aged care facility. But the driver of their meetings with this older adult is around developing this life story. It's only a short story, it's 5 to 10 minutes. A lot of the older adults that we're working with in the facility have got dementia, have got memory or cognition issues, may have lots of complex health conditions. And we pull all of the videos together at the back end of semester in week 13, and we have a wind-up video viewing session. And this is a great opportunity for the families to come in, all of the residents come in. This was all pre-COVID, unfortunately, and we watch the videos together. And it's a fabulous opportunity. We'll talk more about that as we go through. Copies are provided back to the resident themselves, the site, and to the family as well, and have been used even at people's funerals, because obviously this is happening at end of life as well. During the project, the students are assessed on not just the product that they produce, but the way that they communicate with the older adults and the way that they work together in their pair as a team to collect the information. And so we've done a couple of research projects over the years, one of them around their reflective writing and what they've done with it. And that's allowed us to really understand the benefits to the students. So every semester we ask the students, what do you want to get out of this? We've talked about what the project is going to be. What do you want to learn out of this unit and learn from this project of working with these older adults? And reliably, they talk about, I want to know what older adults want and need. I want to feel comfortable when I'm talking with the older adults. I want to know what dementia is and how it's impacting people and how to develop this therapeutic relationship. And unlike in a lot of our clinical practice settings, it's where they're very fast interactions, and we work, sort of go in, assess, we do the treatment, and we go out again after a couple of weeks. Aged care is this beautiful setting where you develop a relationship, and that's such a great skill for these students to learn. Another key area that I just spoke about is that they always want to develop communication, and that's something we focus heavily on in the unit around developing particularly dementia specific, but also good communication skills with older adults. And this project aligns with the content in the unit. You can see the picture there is actually a virtual avatar called Jim, and so he mirrors a person with dementia, and we use him as a practice session, so upskilling students in class before they go back out into the fieldwork setting, into the aged care facility, and communicate with the older adult themselves. And so they practice on a weekly basis, introducing, what are we going to be doing today? How do I manage the person who cannot hear at all, is profoundly deaf, to the point that I had a student using Teams, and we actually live captioned the Teams chat so that the resident could read the Teams at the same time and answer questions that way. They learn time management. They learn how to summarise and conclude a session. Interacting with not just the resident, but also staff and families, because you can't always collect the information from the resident themselves. And learning how to give each other feedback as well. We also focus heavily on the development of professional skills. So self-management, how do I get into this space? How do I develop a relationship? How do I manage my time so that I can get a product? The frequent question I get from students during this project is, she just keeps talking and I can't ask a question. Well, that's a great issue to have, that she wants to talk. Let's work on how do we interject? How do we redirect in a conversation? And we have had these issues and moments in time where students have really struggled to start this process. And the quote you can see from a student is from one of their reflections about what was an issue. I'm looking at the wrong slide, my apologies. We have a great opportunity here for students to see this in a real life fashion. So where they're actually sitting in the space, they're seeing what the activities are, they're seeing what life is like for them. Students get to see issues around sexuality, issues around intimacy and romance. And in some cases, unfortunately, students also see palliative care and work with residents who are actively dying. And it is a challenging situation. It is very confronting sometimes for students in that position, but it does give them that opportunity to keep developing their skills and redesigning what they're going to be doing. I think I was going to hand over to you at this point.
Okay, so in addition to learning about older adults through the project, they're really developing up their professional skills. So things like their self-management, knowing that it's because they've got their end date, and there's all these things that happen throughout the project, like the resident's sick, the resident's in hospital, COVID, or there's a gastro outbreak, so you're not able to go into the facility, but they've got their end date when they need it ready by. So they need to have really strong self-management and time management skills, and this resilience that they can still move forward despite their older adult maybe not wanting to see them that day, or having to change residents. It also really teaches them about being person-centred, because they're really experiencing what it's like to age, all the different changes over that lifespan, and then how they're going to tailor their interventions to suit that person. So interesting based on that first presentation, but we really see that the students transform in regards to their stereotypes of ageing. So at the beginning of the semester, no one really wants to work with older adults, and we see by them being immersed in the centre that they're working within, they start to no longer see older people as old and frail and slow. Instead, they see Marjorie as a tennis player, or Phyllis that grew strawberries for the Queen. So you see a real shift in their language and a shift in an understanding about what it means to be an older adult. So there's heaps of benefits for students. So from an OT perspective, they really learn the journey of being an occupational being and how their roles and activities change over time. And then because they're working so closely with this person, it transforms as far as what is similar and different about my life and their life. And that's by seeing those similarities, that's how we're developing empathy, which is going to be an important skill as a health professional. the students really feel that they're making such a positive difference to the residents' life. So the fact that, you know, they're getting a USB with their life story, and some of the residents have asked for like 10 copies so they can send them all over the world to every single family member that they've known. So for them, it's more than an assignment. You know, they're really making a positive difference to that person. And just seeing the residents light up. Obviously, with people living with memory loss, sometimes they've forgotten that they've been involved in the process, and next minute they're at like a documentary about their life, you know, they're on the big screen and all their family are with them, and, you know, they'll comment saying, you know, how is this possible? How is there a movie about me? And this was one of our residents, Claire, who said, you know, I always knew I'd be a film star one day, just like Elizabeth Taylor, and now I am. So some of the lessons that we learned is that really it can be completed in any setting. So we've tried low care, we've tried high care, we've tried dementia specific, and we can grade and adapt this project for any setting. It just means involving more of the families and staff if the resident can't share their journey as clearly. But it needs to be very, very well managed. So a really strong project plan with clear roles and responsibilities, because there's so much coordination. You know, say if there is a gastro outbreak, we've got to make sure all the students are advised that they can't come on site and that sort of thing. So really strong communication. We see that the students really benefit working in pairs so that they can support each other throughout the process. We want families to be involved because we can then get these beautiful old pictures that more so than just the pictures in the residence room. The students do need to debrief throughout because, you know, some of them find those difficult conversations like, I don't want to live
Apologies, I just hit mute for some reason, or it muted on us for some reason. Can I just check that people can hear us? Excellent, thank you, Xanthe. And so just to finish off, this is some of the examples of how we've the project's been advertised over the years. So it has been going for a really long time, and it has been a really successful project. And I'd like to say thank you to a couple of our colleagues, Sharon and Anel, who've also helped alongside this project with us, and to all the amazing OT students who've gone with us on this journey, and to the host sites and older adults. This has been a really long journey. Elizabeth said it's been about teamwork, about really strong relationships between us as the academics and the OTs who maybe come in and say, hey, we'd love to do this project with you, but really strong communication. There's got to be people on site who are really motivated for this to go ahead so that we can form that really strong partnership. As academics, I can't say enough, you've got to do this. It's fabulous, but you've got to work closely with your community partners. So thank you, everybody.
Wonderful. Thank you so much, Claire and Elizabeth. It's amazing to hear about your program. I can't believe you've been doing it for so long and had so many students through. That's absolutely incredible. I'm really, really looking forward to hearing more about it. Have you got any links to publications or anything that you're able to share in the chat, perhaps, if people want to find out a little bit more?
Yeah, very happy to share some of the publication we've done on it. Thank you. Wonderful.
Thank you so much. And again, please pop any questions in the chat that we'll address a little bit later. All right, so I'm going to hand over to our next speakers, so we've got Trish and Claire from QUT in Queensland. So over to you two.
Hello everyone, it's Trish Rowan here from QUT. Thank you for the wonderful previous presentations from our guest speakers. It's just been so passionate and exciting. Thank you both.
Yeah, thanks so much for having us. Basically what we were wanting to talk about is a lot of what you've already spoken about. We've got a similar process. We're from the field education team at QUT, Queensland University of Technology, and we have social work and human services students that go on placement with Bolton Clarke. Xanthe and I sort of met way back at the start of 2021 in the height of COVID. Let's adjust this so you can see me a little bit better. And it was a ride. There was everyone was in lockdown. People were trying to work out, well, what does this look like and what does this mean in the aged care industry? So that first semester, a lot of our placements were done remotely. And Xanthe worked really, really creatively with all of the different sites to explore how do we bring students in to do this Life Stories work. From there, we sort of started to find our feet, I think, as a program, and then following semesters, we started to bring students on site predominantly. And so students got this really great opportunity to continue doing the Life Stories project, where they were building posters, they were building books, they were capturing people's stories, but they were also working with the lifestyles team and working on the ground, actually learning about how do the facilities work, what is it actually like to be in a residential aged care. So that was really exciting to see students get a bit of a taste for both, and I think it gave them a richer understanding in when they were actually doing the Life Stories program, to then be able to connect to, well, how does that translate for people on the ground in their lives now, and what does that look like now? So that was really exciting. The other thing that I think was really, really helpful in that process was, at the time we had a supervisor who would float across the different sites. So we would have someone from the sites, usually the lifestyles coordinator, supporting the students on the ground, but then we would also have someone supporting them in the Life Stories program. And then myself or Trish or another colleague from QUT would also meet with the students once a week to debrief and to unpack. And I know Trish has some really wonderful stories about some of the conversations and the learning that comes up in that, because I think that's one of the most important parts, certainly for social work in particular, is professional supervision and developing as an identity. And I think this program really gives students a chance to see that. As I was listening to the presentations, I was sort of looking at my notes and going, yeah, that's what I would have said. That's what I would have said. So for me, I think the biggest benefit of a program like this is much of what Asmita reported is around challenging stigma in aged care, challenging perceptions of aged care. And we saw that in the students who often came in kind of going, oh, I don't know what it means to work with older people. It's never something I've considered, especially some of our really young students. Who then have come out of the ends of placements becoming really strong advocates for people in aged care. I had students coming into my tutorial room saying, all right, we need to talk about the upcoming election and what the policies are in aged care and what it means if we don't have a change of government, and advocating to their peers and to their friends and to their loved ones and into the community about the needs for change, talking about how do we use the findings from the Royal Commission to affect change, talking about how do we actually build the role of social work in the industry of aged care, because there's social workers in aged care in the community and with home care packages and things like that. But once people come into residential aged care, often social work disappears. So, a lot of students now are starting to find their feet and identity in aged care and say, actually, there's really a role for us here. There's a lot we could do, and Life Stories programs are a really good example of that. So for me, seeing that stuff has been really, really exciting. What about you, Trish?
I agree. Thank you, Claire, and thanks to everyone. It's certainly overlapping, and I'm echoing pretty much what everyone has said. So my major role has been in the external supervision of social work students, and it's been extraordinary to see the transformational growth. And I think a couple of you have already mentioned it from the beginning. There's been quite a number of students have said, I'm not really happy to go to an aged care facility. That's not great for social work. What am I going to learn? I don't know how to speak to people who have the disease process going through their body. How do I understand this? So throughout my role as an external supervisor, it's been about nurturing and challenging those stigmas within the student, and also developing, I think a lot of them have an innate ability around empathy, but also developing those skills with others. So I don't try and make blanket statements, because some students have had extensive experience around aged care, and some students have shared that they live with their elderly grandparents or that they have lived with them, and that's across a number of cultures, which I found very interesting. But there's also students that have been incredibly confronted by it as well, and felt that they weren't able to use their skills. So also confronted by what we all are confronted by every day of our lives, is the process of life and death. So, and even having that feedback from students talking about incidents where people have died and about how you unpack that and have that discussion. So from my point of view, I think it's extraordinarily important for all of us as allied health professionals. Would be great to see this model run anywhere. And I was fortunate to work within a hospital setting and a community setting over many years, but also at an aged care specific facility where they had the full complement of allied health. So the importance of having that complement also value adds to everybody else, not just the patient and or the resident, but to the families. But the most important role that I've found has been that nurturing role, watching the students or observing the students going from stigma, I beg your pardon, or being very unsure about what this is going to be as far as a placement's concerned, and then developing that transformational positive attitudes towards ageing, which I have found incredibly refreshing. And they've spoken a lot about it during supervision and storytelling and the importance of the person rather than the disease.
Yeah, and I think, Trish, you make a really good point there about the challenges that students face in undertaking placement. I can see in the chat someone's asked a question about whether or not first placement or final placement students are best suited for this. And I think it's actually about getting the right students for these sorts of roles. One of the really great things about the Life Stories program is it starts out just by having conversations with people. So, you know, students' communication skills really, really grow in that process, and so does their confidence. And so we've had first placement students and final placement students, both in the bachelor's and human services, Bachelor and Masters of Social Work and Human Services undergraduate degrees doing this placement. Generally, I think having social work students seems to be really good because they're longer there, so they actually get more time to build those relationships. And of course, all of this kind of work is relational, so the stronger those relationships, the more powerful those transformations can be. But I think recognizing that, Trish, what you're talking about with the role of supervision is key. So especially in those social work placements where students are going to be confronted with a whole range of things, having a supervisor there that can support them and meet with them can make a world of difference. Yeah. The other challenge, I guess, I would love to flag with people that, you know, many of you might have seen in your roles as well, is the power of student poverty. And that's been probably one of the biggest barriers for a lot of the students I've worked with on this placement program. And I think we've had almost like 50 students or something in the last couple of years go through across a whole range of different sites. The competing needs of students needing to work and having families and having outside commitments and trying to juggle that with being on site, and the immense energy that it takes to really learn how to develop as a practitioner. That's been a really big challenge for students, not just in this program, but across the board. And our university is certainly part of a broader program pushing to try and change some of those systems to meet some of the needs for students. But I think that's something to keep in mind for different sites is, you know, ideally we might have students 4 days a week, but what does that look like for the students? And so negotiating and being flexible and working out with the sites, what sites will actually, you know, what days will work for the sites and what days do you want to run the programs? And, you know, if you're having a Life Stories group, what day is that? We need to make sure the students are there for those days. And I think someone said before, Elizabeth, it might have been you, that communication is key. And so I think that's a really, really fundamental thing. Usually we can work through most challenges that come up as long as we're talking and communicating it through.
I think the only final thing, and I agree with what Claire's saying, in social work, it's at least 17 to 18 weeks long. I think we have one of the longest placements. So just to support Claire in her discussion about poverty in students and how we need to take a whole range of things into consideration. But my final positive note, I think a couple of the speakers, all of you have already mentioned, moving from a resident to a person's name. I would like to just share one thing that I would like to finish up with. Not only do students talk about people in the first person by their name, but I've even had students say that I've been back to the facility because I'd like to go and see Betty or Mary or Bill or Bob. This is post-placement. So if that's talking about transformational growth, I feel that our students and our social work students across all allied health, including occupational therapy, nursing and every other profession, it's only going to benefit by ensuring these positive attitudes and positive experiences remain current.
Great, thank you so much, Trish and Claire. I think there's some amazing, messages there, and I guess it, links back as well to Claire and Elizabeth's presentation, basically that these kinds of programs can be adapted to a broad range of settings, and it really is about just being creative, being flexible, and the communication, making sure that that supervision is all in place. But really, I think there is so much opportunity for this kind of work to develop and grow. All right, I'm now we've got a pre-recorded presentation from Sharon Andrews from the University of Tasmania. She's from the School of Nursing and she's based in Sydney. So I will hand over to her. Thank you.
Hi everyone, my name is Sharon Andrews and I'm a senior lecturer with the School of Nursing at the University of Tasmania. And I was lucky enough to be provided with an invitation to come and speak to you about my involvement with storytelling with student nurses who are working with older people. So it's a pleasure to be here talking to you about this, because I think this is a really important part of work of nursing students, of nurses, and really of anyone who I suppose is engaging with older people as well. So my role in the school is to really lead our curriculum around ageing and aged care. And so one of the things that we've done is integrate a section or a module around understanding older people's life story and understanding that through the power of storytelling. So what we found since we've started putting that content into our degree is that students love it, because they start to feel a connection with particularly the people who they're looking at through some of the videos that we've developed around life story, but also we get students to actually go and work with an older person and actually understand their life story and what's important to them and what their preferences are based on that life story. So what I thought today is that I would actually take you through something that I've shown students before that they really enjoyed. And hopefully you can feel a little bit of connection or resonance with this. But this is something that I do to introduce students to the importance of understanding life story and understanding people's history. I'm going to do a screen share. So I would like to introduce you to Arthur. So Arthur is actually my grandfather. And I first introduced Arthur to students in some education some time ago to really demonstrate to them the importance of understanding people's story and really get them thinking about what do they need to know in terms of, older people, what's important to them and where they've come from as well, but also who they are now and continuing as well. So I want to introduce you to Arthur. So as I said, he's my grandfather. And this is a photo of him here. So he was born in 1903. So Arthur died a number of years ago now. He was married for 67 years to Mary, who was his wife. And he was also a father of a number of children, which we'll get onto. But looking at this picture, what I talk to the students about is that from this photo, you can't really tell much about Arthur. And it's a little bit like if you're looking after someone as a student, you don't really know much about the person you're looking after. You might be able to tell some things from their physical characteristics, from their appearance, maybe from their accent if they have one, but you don't actually know a lot about who that person is. And likewise, you don't know a lot about who this person is on this picture that I'm showing you. And so the point being really is that we really work with students to help them understand that, getting to know someone actually takes time, and it takes quite a bit of effort and commitment as well. So what else can I tell you about Arthur? If you were a student and if you were working with Arthur and doing his life story, you would learn a number of things about him. you would learn that he was the father of 8 children. And you can see here in this picture, this is Arthur in the centre of the picture, looking very stern because he was quite a stern man. And this is his wife, Mary, my grandmother. And in fact, that's my mum up the back there. But what this picture really tells you, and if you were talking to Arthur, you would have learned, is that actually family was very important to him. And it played a big part in his life as well. So he had, as I said, 8 children, and he subsequently also had a number of grandchildren as well, which obviously we'll get to. And you can actually see a couple of the grandkids in the front of the picture there. So what else would you have learnt about Arthur? Well, you would have learnt that, in fact, he was a farmer. And he grew crops. He grew many crops. He had a big property. And in fact, it would take him, and he would tell you, about 3 hours to ride on horseback from one end of the property to another. That farming was a very large part of his life, and being on the land was something that was very, very important to him, which automatically should start to signal, if you were a student and working with this gentleman, that in fact, okay, being outside was actually quite important for him. And this is important for us to know, and would be important for you to know if you were doing his life story. He was also a bee charmer. So he loved bees ever since he was a teenager. So he would have talked to you about bees until the cows came home. But he could go to hives of bees. He wouldn't smoke them. He really was a true bee charmer. And of course, the bees remembered him. And he would be also probably someone who would be telling you that bees would remember you as well. And we know that they do. So that was a very important part of his life, from when he was young, a teenager, right through to when he became an older man, as you can see in this photo. So being outside, you know, working with bees, and also working with cattle and horses was also very important. So he really was a classic farmer. And so automatically this information, if you're developing a life story with someone, you would start to think, okay, so being outside, being in nature, these are all quite important things to him. Okay, what else would you learn? Well, you would have probably heard about Silver, who was the horse here in this picture, and these are 2 of my cousins. He loved horses, and he particularly loved this horse, Silver. And he taught most of his grandkids to ride on this horse, including myself and my sister. And so again, you know, it was really about family connection and connection with animals in his care as well. And so we also would have talked, you also would have talked about, if you were working with him, his twin granddaughters, and we spent a lot of time with him. So this is actually my sister and myself. And really, you know, in terms of what was important to Arthur all throughout his life, as I said, it was really his farm and his family. And he also did actually enjoy dancing as well, because I used to go to quite a lot of dances. So why am I telling you about this? Because I suppose what I'm trying to demonstrate is that people we know have rich histories. And when we work with nursing students, we really want you to understand that the people that you look after, by the time you see them, they may be older, they may have more disability, you know, and they may have dementia, but they come to you with a very rich history and a very rich life story. And if you can understand that, then what you can do is actually start to think about the sort of care that you can provide. So I've told you this information about Arthur. What I haven't told you is that Arthur ended up developing an Alzheimer's type dementia. And he ended up with quite advanced dementia and in a nursing home. And he would yell out often in the nursing home. He'd cooey, he'd yell out, he'd talk to the birds, he'd call the horses, he'd call the dogs. And a lot of the staff didn't understand why he was doing this initially. And he was doing that because he thought he was on the farm. Now, once staff started to know him better, understand his life story, we provided a lot of information, they would be able to go and speak to him and say, you know, it's not time for the cattle to be coming home yet, or, you know, your son's out on the horses, you know, rounding up the cattle, so there's no need for you to worry. So understanding Arthur's life story was really, really important to actually providing a person-centered approach to care, and to really ensuring that they were able to actually care for him in a manner that met his needs. Because, not surprisingly, I'll just stop my share, not surprisingly for Arthur, he continued to be worried about his farm even while he had dementia. So I suppose I tell you this story really because I tell students this story to help them to understand the importance of life story, because it's not just about knowing someone's history, but it's also about knowing how you deliver and provide care when someone becomes a lot older and sometimes might not have the cognitive capacity to tell you what's important to them. So we were able to work with the staff to actually explain to them why my grandfather was calling out, why it was important for him to be visited by, for example, one of the therapy dogs who came to the facility, because he'd always owned dogs, why it was important to always have honey on the table for him when he was having a meal. So in terms of understanding people and their preferences, it really is absolutely crucial and important. And sometimes it's not that easy, and sometimes it's really hard for students to engage with older people, and it's considered to be boring, and it's not something that you necessarily see yourself doing as a nurse. But I can categorically say that there'll be very few nursing students and nurses who won't have some type of engagement with older people and need to understand their story in order to provide care. So it comes with challenges at times, but that's really part, I think, of being a nurse and caring for people across the life course and across the spectrum. So I hope that this video has helped you to understand a little bit about why life history and life story is really important to us at the University of Tasmania, and why we think it's really important for nursing students, because ultimately, in the end, we all live through stories. We all have stories. We all tell stories about ourselves and our life. Older people are no different, but your job as nursing students and as nurses is to hear those stories and then to use them in a therapeutic way to provide the best possible care that you can. Thank you.
All right, well, that was great. A great presentation from Sharon. And it's actually great to see it sort of come to life and really kind of make that connection between an older adult's life experience and then understanding how that can influence behaviours and responses and all of that kind of thing. And just by having that understanding, adapting the care and the way staff interact with older adults, I think is incredible, can have an incredible impact on people's quality of life. So, all right, well, lots of questions coming up in the chat, so that's great. Keep them coming. Now I'm going to invite Olivia and Kate online. So Olivia and Kate are both students who have completed placements with Bolton Clarke. So what I'm going to do is just ask both of them to briefly introduce themselves, and then we'll get them to talk a little bit about their experience. So Olivia, do you want to go first?
Yep. No problem.
So do you want to introduce yourself, what course you were studying at the time and what you did?
Yeah, so when I have my placement in Bolton Clarke, I was doing the Master of Social Work, and yeah, I graduated last year already. I remember like the placement was in 2021 as a social work student. Yeah.
Great, thanks, Olivia. And Kate.
Hi, I'm Kate. I'm a Masters of Social Work student with JCU, and my first placement was with Bolton Clarke, Glendale and Townsville. So it was quite an eye-opener, but thoroughly enjoyed it.
All right. So when you say it was a bit of an eye-opener, Kate, do you want to explain that a little bit more? What were some of the things that you found?
From a social work perspective, a lot of advocacy issues that I'd like to explore further. Just access to like mental health care and all sorts of things, especially in a regional facility as well. And with the life story work, I also lost one of my residents that I was working with. He passed away, and yeah, that was a bit sad. It was an amazing experience, and I learned so much.
Yeah, thanks, Kate. And I think that's where it's so important to have that support from your supervisors at the university, as well as a really supportive team at the care home, and and we provide that support as well. So I think that kind of echoes some of the comments that have come from the university supervisors as well. So thanks for that. Olivia, what about you? What were some of the things that you gained from this experience?
I would say I learned a lot of skills from my placement, especially communication and listening skills, and also like even for the small thing, how I can have interaction with older generation. Especially I just made a interesting, like kind of funny mistake in the beginning, because I know the consequence for older adult if they fell over. That will be terrible for them. So what happened is I saw a lady like drop down one of the items, and I pick it up without asking her. She was so mad at the time, because for me, I'm just like, I don't want her to fall over or make any trouble kind of thing, but I realized I should respect, like, she's very independent person, and I should realize that. But luckily, in the end, we have that conversation and all good. Yeah, so these kinds of small things I learned from my placement, which is very beneficial for me. I get more idea how can I work with older people. And also another thing what I learned is, as a young person, I still on the process to build a perspective of the world about myself. But I work with people like about like 90 years old. They have a lot of life experience, working experience. When they share this experience with me during the storytelling, I think it's really, really impressed. And I know, oh wow, actually I can do something like that, or I can learn something from that. Yeah.
Great, thanks, Olivia. What about you, Kate? What were some of the things that you gained from the experience?
Lots of rapport building practice, lots and lots of it. It was absolutely amazing, because when I was working with a couple of residents who had dementia, I did get the opportunity while we were playing bingo or Hoi, or a bingo type game, to just, if something didn't quite have much of an effect, I got the opportunity to try again in 5 minutes. So it was really good. And just finding a way to ease some distress as well, because one of the residents was worried they had to pay for the game, and this happened every 10 minutes, and I had to reassure her and say, no, it's free. And she was just amazed. She was like, wow, it's free. So it was great, because I did get to try out a few different approaches, and also the lady I worked with, to build her storybook. I developed a nice relationship with her. I got to meet her family, her daughter and her grandchild, when we presented the book to her, and she had an amazing story to tell, just massive. And it was very hard to get it all into one book. But Xanthe and Asmita and Georgina helped a lot. So lots and lots of skills there. But I do know that right at the beginning of my placement, there were questions over whether a first placement student was suitable for aged care, because some of the themes that were coming up right at the beginning. And I think Claire earlier on said, someone was talking about, was talking about first or second placement students, and it really does depend on the student, because it just depends on your maturity level and your willingness to learn and be a self-learner too, because you have to be really flexible and really on the ball to keep going. We didn't have a social worker on site. We had a task supervisor, and you've got to be really onto it as a first placement. Yeah,
no, thanks for that. And I think that is, something we can all acknowledge is that it can be a challenging space to work in, and especially for students that really haven't had much exposure to aged care or never been into a residential aged care setting before and had good chats with older adults. So Yeah, it is. It can be challenging for some students, so that support's really important. So talking of challenges, we've talked about that kind of, I guess, that need for that support and supervision. What were some of the other challenges that you encountered, Olivia?
Wow, I would say because as an international student, the first concern and challenge for me, I would say, is language and culture. In the beginning, when I got the opportunity in this placement, I really worried about whether I can communicate well with the older adults and whether I can fully understand the culture they're from and also with my culture perspective. But yeah, it's all kinds of learning process. I have great time with the president in Bolton Clarke, and when I have like, can you please repeat again like what you say, they're always happy like to repeat again to me or introduce more information to me. And yeah, they're all very friendly. And the second challenge for me was I was thinking about how can I identify myself as a social work student in aged care facility. Like, because what I learned at uni is different from what I do in practice. I'm trying to like, how can I apply for what I learned, the knowledge in my practical work. And yeah, I'm very grateful I got the support from Bolton Clarke and from QUT as well, because like specific from QUT, we have external supervision, so we can unpack more what kinds of things we can do as a professional social work student. And then also when I mentioned about, can I do something like the digital story? And then I got the support from Bolton Clarke, and then yeah, so I have the chance to demonstrate my social work skills and my idea. Yeah, so I would say, yeah, I do have this kind of challenge, but in the end, always can find a way to solve it out. Yeah.
Thanks, Olivia. And we'll show you Olivia's beautiful little digital story that she created about her placement very shortly. So, but Kate, just to finish off, what were some of the challenges you faced and were able to overcome?
I actually had two other peers with me, international students, and I found myself supporting them a lot through the language as well because of the older generation and just some of the idiosyncrasies. Yeah, they needed a lot of help with that too. So I found that was a challenge for myself because I was not only balancing my interactions with the residents, but also like helping to support my friends, my students as well, that worked with me because they didn't understand the language too well. And yeah, that was a bit of a challenge. And it was challenging not having a social worker on site as well, and not having, it was only my first placement, it was my first year of my master's, and throughout the master's in JCU we don't do anything that's specifically focused on aged care. Right. And when I got into the aged care facility, after a couple of weeks I started to realize that a lot of the preparation and the theories and things like that are focused on people who are moving towards increasing independency, like children growing up and becoming independent. But one of the issues in aged care was, well, it kind of confounded me, was that people are moving towards increasing dependency, and then how do they maintain some sort of autonomy as they become more and more dependent on carers? And yeah, that's something I'm thinking about now. So it's quite challenging to watch people become more and more dependent. And some people did become more ill over the time that I was there because it is a bit of a long placement. So you get quite a few months. And it was hard to be helpless, really, like seeing a lot of things that needed to be done that, just won't be tackled for 20 years yet. Very difficult. I found that challenging.
Yeah, thanks, Kate. And I think that's just such an important point that you've raised in terms of health professionals, because, often we go in as clinicians to cure people or to, like you say, improve their independence. And in aged care, we can't necessarily cure their conditions, but we can improve their quality of life by understanding their needs and their preferences, we can do our best to achieve that. So
I think it was important for people to accept that this is end of life care, and it matters. It does matter.
Thank you. All right, well, let's just jump quickly. Georgie, are you able to pop Olivia's digital story on, and then we've got recordings from a couple of the other students. So.
Do you, on the top of your head, know any good slang? Some Aussie slang?
Aussie slang?
Yeah.
Red Rover or over?
Red Rover or over. I know g'day.
G'day from
G'day.
WA.
Yeah.
My girlfriend rings up. G'day from WA.
So as you get older, you can't always hear as well, so you can't watch much television. Whereas you can read a book and find out what's going on, although it may take you 2 or 3 days to finish the book completely. It also, by doing that, makes you keep on remembering things and keeps your mind active. I've always been a pretty active sort of a person. I joined the Navy at 21 and I could walk the deck of a destroyer with no problem until I retired. When I retired, I was Lieutenant Commander, and been through officers training class in Flinders Naval Depot and in my youth. And I've been there, done that. I've been all over the world. The only country I haven't been in is Russia.
Hello, I'm Olivia. I'm a placement student at Bolton Clarke. I'm doing the Master of Social Work at QUT. I found it is powerful when residents share their life story in the life story projects and the life story circles. I think it's a kind of empowerment for them when our placement students present their life story on the photo book and the posters. You can tell how amazing when Xanthe has those social interaction with our placement students, and when David concentrates on his reading, and Gordon how he shared his rich life experience to us. The purpose of the digital is not only to present how the meaningful life story looks like, but it also contributes to advocate some people should change their stereotype of aging, because you can tell the elderly look so amazing, they look so gorgeous when they talk about something they really enjoy.
Thank you so much. I love that little digital story. And, you know, it's lovely to see all of the different programs and the different approaches that people are using in terms of telling the story. The people from Curtin, you know, they're doing digital stories as well. So putting them up on the big screen and all of that kind of thing, or creating books or posters, and, you know, digital storytelling is another output. So we really encourage students to be creative in terms of how they share an older person's story, you know, when working with the older person in terms of how would they like to tell their story, what format, and drawing on the creative arts can be incredible as well. So, all right, we're going to go to recordings from 2 other students. They are also from QUT, social work students who did their placement at Talborough residential care homes. So we'll just go to their recordings and then we'll have a quick chat with Nick and Heather, our lifestyle coordinators.
Good morning, everybody. My name is Matthew. I am a previous social work student and did my final placement at Bolton Clarke Tarbera, and can only speak highly of my experience. And I'd love to share some insights and reflect on my experience at Bolton Clarke. So as a social work student, it was a bit daunting to start off with first, to be honest, but I grew to totally love and appreciate the experience towards the end of it, of course. Our role as students was quite varied. There'd be days where we would be helping out with bingo, providing companionship, going shopping. So there was so much fun in the placement. But I suppose the primary purpose, of being there was conducting the Life Story project, which was facilitated through the research team at Bolton Clarke, which were incredible and totally supportive throughout the journey. The ways that this project was ran at our facility was primarily through a storytelling circle, which we called the Story Circle, and also the Life Story book, which was a one-on-one sit-down interview with a resident where we will record it and transcribe their audio into an amazing book that we printed, and they can read and reflect on their stories and realize that they've lived such incredible, long and worthy lives. The Story Circle was more informal at our facility. We sat down in a circle with residents, students, and our amazing supervisor on site, and we just chatted really. It was really great to hear everybody's stories, and they all had such fantastic input. And through that story, we were able to delve into some sort of intimate topics, really, talking at length about things like loss and grief, to upbeat things like music and family. So it was varied, and it was fantastic to see how we all grew closer towards the end of those final weeks of the Story Circle. Being a part of the storytelling project with Bolton Clarke gave me so much experience, and it truly was an experience that I will never forget, and I haven't forgotten it. I still think about the residents to this day, and the conversations that we had and the stories I heard really changed me. And I look back on myself at the start of my placement, and I recognized that I was very scared and felt overwhelmed because I was embarking into an environment that I didn't know how I would go. I didn't know how to deal with these conversations where somebody is in the later stage of life or dealing with conditions like dementia. And I didn't know what, for example, dementia would look like. I didn't know how it would change a person. And I realized that dementia, disease, disability, our conditions don't change who we are. And that was really transformative for me. And a key learning from my placement is that we are more than our age, our conditions, our diseases. We're so much more than that. I believe the process of telling stories is so important, particularly for older demographics. It improves mood, it increases social connection. From a student perspective, quite selfishly, I had opportunities for intergenerational learning, which were incredible. I learned about World War II. I learned about so many things in history that I didn't know existed. The lady that I completed my storybook on had dementia, and she would often repeat the same story sort of every day. And I know that it was important for her to talk about this particular day, the day that her husband passed away, because it gave her a chance to reflect and to share the life that she had with this man. And I just listened, and I was privileged and felt honored to be hearing what she was telling me because it was so personal to her, and I don't think many might have heard that story. And as a student, I just am I'm totally at a loss of words for how incredible this opportunity was for me. I truly learned so much about myself and others, and would encourage everybody to share their story and to listen to other stories, because it's important and it just changes us. Yeah.
All right. Wow, that was incredibly powerful. You can really see that transformation. I'm just mindful of the time. I think Byron's presentation is only a few minutes long, so we might pop that on and then jump to Nick and Heather before we jump into our Q&A. So.
Hello, my name's Byron and I am a social work student at QUT Brisbane. About 6 months ago, I did a placement at Bolton Clarke, Talbara, where we had the privilege of doing the storytelling program. This involved sitting around in a circle and talking about our stories, as well as also doing storybooks and posters for the residents. So through this conversation, I'm going to talk a bit about the challenges in my experience. So first off, my experience of the program was actually quite beautiful. Being able to sit down with some of the residents and talk about their life and their experience is not something we do often as a society. I believe that the more we are able to do it, the better society is. My personal experience with the program was that we were able to see a few residents be able to open up, to communicate better, to find a community, to air some of their frustrations out. So such things as trauma, such things as things that made them happy, also things that really didn't matter, like their favorite flavor of ice cream. And through this discussion, you could see that a bit of life was given back. I believe this is because we don't give enough time to listen to our elder generation in this culture. And I believe through the storytelling program, we actually placed a lot of value on people's lives. But that's not without its challenges. I also felt that one of the biggest challenges for me in the program was actually dealing with some of the conflict within the circle. In a circle of around 8 people, there's bound to be some kind of conflict. So you're going to find that some people's opinions don't always mesh with others. The challenge I found was as a young person, where do I sit in this equation? Do I agree with one person or do I agree with the other? I had to seek some counsel around this, and I found that I landed quite nicely with how I felt at the end of the program and where the conflict was resolved. But when we're looking to my future, I believe this program's actually taught me a lot about what I want to bring into my future practice as a social worker. This includes my passion for the elder generation and believing that there is actually a space in aged care for social workers, a space that is desperately needed. I also believe I'm going to bring the storytelling into my own practice by involving it in other people in other generations' walks of life. So even the youth would value from this. Even people who have faced trauma would value this, because it's intrinsically placing value on their stories and their experiences. So I think going forward, Talbara and the storytelling program is something that should be highly valued and should be a program there's an emphasis on getting everyone involved in. But to finish, I just want to thank Talbara. I want to thank Bolton Clarke for the wonderful placement they gave me. It was a pleasure. And thanks for growing me as a future social worker. Have a nice day. Bye.
Oh, it's wonderful insights from the students, and certainly the group work adds a whole new dimension to it as well. So interested to hear people's comments on that one. Let's just bring Nick and Heather online, and we'll just hear from them briefly from a lifestyle coordinator perspective. So Heather, is Nick still there? I think he popped in. No, okay, he might join us in a little bit. But Heather, so do you want to just quickly, briefly introduce yourself and the site where you are and what's been happening with the program?
Sure. Hi, I'm Heather. I'm having a proud person moment at the moment because those last two students you just saw were mine. I'm at Talbara here at Waterford in Brisbane. I have been with the Life Story program almost since its conception, but at that time I was working at Currumbin Waters under a phenomenal mentor at Currumbin Waters who taught me everything I know, the wonderful Gwen. So with the first, I've been here 3 years now. I've been here at Talbara for 3 years and thoroughly enjoying every minute, except for COVID sometimes, you know, ruins the flow of things.
Yeah, it was a bit disruptive, wasn't it, to say the least? All right, so how was your experience working with students and hosting students? Because as a lifestyle coordinator, that was possibly a new experience for you, I think.
Absolutely. Yeah, absolutely. The first one I had was Jess, and you came with Jess, Xanthe, so that made life a lot easier, and, you know, in trying to figure out how this would all work. Then the next lot of students I had, there was 4 of them. They were fabulous. They were, and all from China, and so we learnt together about, you know, language barriers and about how to get people to understand and cultural issues. But whenever we faced an issue, we just had a group chat, talked about it. Then, of course, they would go to their external supervisors. So I would just like to say I've just been taking notes about a few things like the student poverty. I did have a student that did have to work, and she worked very hard, and so we worked around her hours trying to get her to come when she could when she was working. But I also, she being an adult, I offered her place at my place, so she would stay with me for 3 nights a week so that she could do her placement, and I would drive her to work and home again. And then on her last day every week, she would then go back home to be able to do her work. So I am fully aware that there are struggles for our young students out there, and I am determined as a lifestyle coordinator to make this storytelling process work for the students, you know, their placement work. So then I've had another 2 students, both from international, and then my last lot I had were 5, and they were all mixed. So I've had an incredible array of students in the last 3 years.
Yeah, thanks, Heather. And I mean, you're just such an incredibly, you know, warm and caring person. And I think, you know, it is really, it is something that we need to think about, is the well-being of the students as well, and acknowledge that a lot of them are juggling a lot of other things and responsibilities and life challenges as well. So I think, you know, doing our best to work with them is incredibly valued and appreciated. So yeah, that's really lovely to hear. What would you say some of the benefits that you've seen in the students from this experience?
The benefits for the students or me?
Okay, both. Go on.
Okay. I mean, I've heard you all talk, and I even heard the students talk, and they actually came to me, a couple of mine when they first came here. Why am I here? What is this to do with social work? And quite frankly, I didn't know either, you know, so we did some research together, and we decided, you know, we looked into research into the social work in aged care, and that there are some sites that do have social workers on site, and together we worked out how this would work for them and what they would do. And they did get involved, because I am a lifestyle coordinator here on my own most of the time, so they did get involved in some of the activities that I run, but purely that was because I thought the benefit for them was to get to know the resident before the resident would trust them with their life story. That was just my approach to things. But and my benefits was, well, just watching these people, like I have just formed incredible relationships. I mean, some of these students have even invited me to their graduation. They paid for a ticket, and I went and watched my students graduate. It was just an incredible pleasure. I have nothing bad to say about this program. Even when we have challenges, we talk to you or we talk to external, we find a way around it and we make it work. It works for everybody, but especially the residents. We have tears when they go from the residents because they don't want their students to leave. We have a big welcome morning tea and then we have a big farewell, 4 months later, trying to remember that you should never just disappear from an older person's life because that's just unfair. If you've been in it for 4 months, you should explain to them where you're going. So we make sure that, there's a happy sort of exit and they know. And I am one of the lucky ones that has my students come back. They come back to see them on a regular basis and drop in and say hi and visit them. So I'm very blessed.
Wonderful. Thank you so much, Heather. I think it's great to hear the all-round benefits and just the partnership, that it is it's a true collaboration. And I think, that's really important in terms of addressing some of the issues that I guess Asmita raised earlier, in terms of workforce and attitudes towards working in aged care and addressing some of the issues around attraction and retention and roles of different, professions in the industry. So, yeah, I think that's really great. Just to finish off, because I'm very mindful of the time, any final key messages that you'd like to share with people about your experience and having students in this?
If you get a chance, take a student on. I know that some of us are really busy and sometimes you think you just don't have time for it, but it benefits everybody, but especially as we are advocates for these people that I work for, my wonderful residents. I'm an advocate for them and I will do anything that makes their lives better, and having these people in their lives makes their lives better.
Great. Thank you so much, Heather. And thank you very much to all of our speakers. I hope you've enjoyed this. I'm just going to spend the last couple of minutes now. I realise that it is 11:30, or it is whatever time it is. Our time is up wherever you are. But if you're happy to hang on for a little bit of a discussion, then you're more than welcome. A couple of things that came through. I think we've addressed quite a few. There's a question about intergenerational dimensions. So, Mark, do you want to just jump in? And you've got a lot of experience in this area as well and working with students. So did you want to jump in and share some thoughts? Oh, is Mark still there? Oh,
yep, I just had to give Mark permissions.
Oh, I'm sorry. Yes, it's meant to be on the chat.
Sorry. That's okay. Can you hear me?
Yes.
Yeah. Oh, look, thank you very much for a brilliant presentation. I just wanted to question two things. One was, I think the intergenerational component, they are tertiary students and the age group is huge. And I think we need to explore that, because part of the learning and part of the relationship is because of the age difference, and we need to make most of it. And the other thing I just leave open in the air is, what elements of a story make a good story? What elements of a story, whether it's a book or a digital story, make it emotionally engaging and impactful? And I think that's another area that we could explore more. So I know there's no time, but I just thought I'd throw those two questions in because I think they're implied. The intergenerational component is obvious but not addressed. And I think we've got to learn a lot to learn from the success and the less success of stories and the process involved. That's enough from me.
Thanks, Mark. And I think Claire from Western Australia, you put some comments in the chat about different formats and different outputs and different things that you've tried. So do you want to comment on that?
Yeah, so that's in my role as an OT on the site. So trying lots of different formats, and I think it's really important for the students to be able to learn what format is going to be best for that resident. Like if you've got a really chatty guy that, he just wanted to share his story in minute detail, like it has to be a book, because you just got to get so much content in there. But someone who is more in that progressed stages of dementia, really we just need to have like the images that they connect to. And then you're also thinking about what's appropriate for the site. And I guess that's having the digital movies. I mean, you can then show them at a handover. And I use those digital movies a lot when we were having residents with responsive behaviours. So if we had a team meeting, the first thing I do is put up their digital movie, and then all the behaviours make sense. Just like with the talking about the gentleman who was a farmer, like you start seeing all these behaviours. Oh, that's why he's doing that, or that's why she's doing that. So so it really lots of any format is fine. It just depends how much time the students have got. And I love hearing that about the social work students, that they're for so long, so they can really develop up that great relationship. And I guess that's the same with our students being there for the whole semester.
Great, thanks. Thanks for that. And I think, that's part of what we're thinking about, and the area that we're really interested in exploring further is then how we translate that information, or how we transfer knowledge gained from doing these life stories, to share it with other staff or to inform care plans and all of that sort of stuff in an ethical way. But I think the digital stories are a really powerful way of sharing those stories to a broader audience. The posters, of course, are really great because they hang in the rooms, and the books give that much deeper kind of story about a person's life. So
definitely. And the good thing about when you're making the movie, because they're generally doing it in either Canva or a PowerPoint. So PowerPoint, you can also then just print the slides. So then you've got the book as well. So you can put the movie on some stage, in the afternoon if the person's unsettled, or put the book down in front of them. But you need so many copies of everything because everything goes missing. So, you need that electronic copy to be able to reprint or
Exactly. All right, well, I'm really sorry, but we're going to have to end it there. And I know we could keep chatting forever, but I just want to say a massive thank you to all of our speakers. I think it's just great to hear so many different perspectives and experiences of storytelling with our aged care workforce and our students coming through, and how important that is, and the benefits that it can have for everybody. So thank you again for attending, and wish you all the best. Our next one is going to be on intergenerational storytelling. Interesting, Mark, funny that you brought that up, and we're on Friday the 28th of April. So keep an eye out for that information that will be coming through. All right, enjoy the rest of your day. Thank you so much, everyone.